Hello, everyone, and welcome to our LabCoP Eco session for today. My name is Francis Ochen from the African. Can you confirm that you can hear me?
Francis, I can hear you, but there is a background noise from one of our presenters.
And I hope all the interpreters can still hear me. Okay, so we can get started. And colleagues, welcome to our eco session for today. My name is Francis Ochen from the African Society for Laboratory Medicine. I'm delighted to be your moderator for the session today. Our session will run for 1 hour. We'll take 2 presentations and get into the questions and answers. We do have language interpretation services. Please keep to one of either English, French, or Portuguese, and stay away from the off channel. Our session slides and recordings will be made available to you, and please do join the discussions through the chat. We caution you not to share your personal information through the chat for your data security reasons. You may be aware that medical labs provide diagnostic services to detect and treat diseases besides research, surveillance, and training. And on a daily basis, labs generate, store, analyze, and process an infinite amount of data with multiple variables, including sample descriptions, test results, predictions, of course, all scientific data that's generated. And all this needs to be stored securely in a predefined order while ensuring ease for access to authorized individuals and units for their subsequent utilization. And so in today's session, we look at the concept of data connectivity framework, drawing from one system, the DataToCare that was developed by SAVICS. We will also introduce the SAVICS Academy, a knowledge hub that really ensures sustainable digital investments for adopting countries. And finally, we'll get some sharing of experience on the use of DataToCare on GeneXpert platforms in supporting TB diagnostic network in Benin. And colleagues, our speakers for the day are Dr. Damien Bertrand, and Damien is actually the Chief Business Officer with SAVICS. And Damien holds a doctorate in physics and additional qualifications in innovation and business management. Through more than 15 years in the healthcare industry, he developed a broad understanding of the leading tendencies and needs of global health sector, specifically in the digital space and artificial intelligence, with a view of actually bringing a real impact to people's health. And the second presenter is going to be Professor Diso Afolabi. And Professor Diso is the National TB Program Manager and Director for the Benin's TB Supranational Reference Lab. Professor Diso holds a medical degree and a master's and a PhD in medical microbiology. He has been working in the National TB Program of Benin since 2004, and is also currently a professor of microbiology at Abomey Calvi University in Benin. He's also the executive secretary of the West and Central African Network for Tuberculosis Control. His research focuses mainly on understanding the dynamics of TB epidemics in West Africa and developing tools to improve TB control in low resource countries. And so colleagues, welcoming our presenters, starting with Dr. Damien. Damien, over to you.
Thanks, Francis, for this introduction. Hello, everybody. It's a real pleasure for me to be with you this afternoon for sharing a few information about DataToCare platform. And it's also a pleasure to share this session this afternoon with Professor Afolabi, who was really pioneering this effort on connectivity with us since 2016. So before starting the presentation over DataToCare, just a few words about SAVICS. SAVICS is a company that was founded in 2016 with the purpose of supporting healthcare systems through the use and the development of targeted digital technologies. This is something that we don't do only on our own, but we do that collectively by teaming up with local resources to have really a strong impact and a strong anchorage with local communities. Not only we recruit our staff in the countries in which we operate, but also we train local people, we collaborate with these local people to have efficient digital technologies that are rooted into the local health system and that prove very efficient. As it was mentioned in the introduction by Francis, we will discuss about DataToCare, which is a digital platform ensuring the connectivity for the digital laboratories. The value of sharing data has been mentioned already. Sharing the data is helping the different stakeholders contributing into the effort, the healthcare effort. It's helping sharing the information with those who need that information, getting faster to the patient and getting faster to the decision makers in order to have efficient healthcare systems. DataToCare is really designed on that purpose. DataToCare is a technology which is used for, first, to collect the data into the laboratories by connecting directly on the devices, on the diagnosis instruments that are used within the laboratory. When that information has been collected, the data from a network of labs are consolidated into a unique server, usually into the country. And based on a comprehensive database that is being made available, there is a possibility to visualize the data through a custom dashboard, through meaningful indicators that reflect the situation from a public health perspective, and also the possibility of producing reports automatically. These are really the reasons for which DataToCare has been developed. DataToCare has been deployed already in almost 20 countries. As you can see on the screen, we have a very strong presence in Africa, but we have also some footprint in Southeast Asia. And the platform is constantly evolving, meaning that not only we install the system in new countries constantly, but we also bring new features based on the feedback that we receive from our users, based on the IDs that are submitted to our community. And based on that, we constantly upgrade the systems that have been made available to the early adopters, so that the whole community benefits from very modern and efficient software. It would be time-consuming to list all the features of DataToCare, and that's probably not the purpose of the seminar this afternoon. Functionalities that are proposed by DataToCare. First of all, DataToCare is used for harvesting data, meaning that within the laboratories, when the labs need to record data from the patients, not only access the test results, but also harvest data from the patients, we have custom forms that are deployed on the computers into the lab to facilitate the brilliant. So I was mentioning about the data capture of patient information from dedicated forms into the lab. The second key feature of DataToCare is the notification of the information. It's clear that the primary purpose of diagnosis effort is to diagnose diseases, inform the patient, and have the patient getting to the doctor to receive the appropriate treatment. We ensure that this is done very fast, especially for transmissible diseases like tuberculosis or HIV, which are the leading use case with DataToCare, by notifying the patients and the doctor immediately when the test has been received. By notifying this information, we ensure that the patient comes back into the health facility faster to initiate the treatment. Next to that data sharing, it's important to emphasize the interoperability of DataToCare. Not only we can connect a diversity of instruments, we dominantly get the information from GeneXpert machines and TrueNAT machines, but we can connect also a variety of other instruments from the laboratories. And based on the information that we have harvested, we can process that information within DataToCare, but we can also share the information either on a granular way or on aggregated way with external systems, be it the information systems into the lab or the public databases like DHIS2, which is illustrated on the slide. So the purpose is really to facilitate and streamline the flow of data and information across the users and across the system. And finally, let me emphasize the importance of having functionalities that are tailored to the field and to the reality of the field. In some situations, for example, the patient is not traveling to the lab, but the patient is taken care of within a primary care facility, and only the samples that are harvested will travel to the lab for being analyzed. We have a mobile application for DataToCare which allows the doctor into the primary health to support that workflow and refer the sample of the patients directly to the lab with the proper traceability on the results and on the information. Second important feature is what we call DataToCare Lite. As it was emphasized already, there's no need to replace or to duplicate IT systems if some are already present. So if the labs are using existing technologies already, then we will run in the background and propose a lightweight version of DataToCare, which will travel the information, capture and exchange the data in the background without having any user interface and without duplicating the effort of the users. Now that I have emphasized the key features of DataToCare, let me spend a little time on the success factors for connectivity, because indeed, connectivity is not just rolling out software into the labs and into the coordination offices, but there are a number of important factors that ensure the success of such initiative over time. The first success factor is, of course, the infrastructure. It's important to realize ahead of implementing that project the context in which the project will take place. It's important to have the infrastructure for feeding the computers and servers with appropriate and stable electricity. It's important to figure out whether internet is available or if we need to come up with other technologies, for example, SMS data transfer, which we can support with DataToCare in case internet is too weak or not reliable enough. All those infrastructure questions needs to be documented at the very beginning to be sure that the project which is being rolled out perfectly meets the local context in which it will need to operate. The second aspect has been emphasized already. This is the question of interoperability. That technology will prove efficient if it's naturally blending into the IT systems that are already in use within the the health system. And to ensure this interoperability, we take care of using, to the best we can, the standard international technologies and protocols so that this interoperability becomes quite natural with existing systems. The governance is also very important, not only because we talk about health data, for which the security and privacy are really important. So we take care that these data are highly protected at the lab, during the transfer, and down the road when they land into the database. It's very important to ensure the safety of those data. And we do that through a multiplicity of approaches, both technical approaches, encryption, and as well as processes and protocols. And for example, we can define different roles for the people who will access the data, and depending on the role, some people will have different access to the data to preserve this data privacy. It's important also to have this kind of data sharing workflow well understood and well integrated into the administrative pathways that are being put in place for the health system. The whole system needs to be aware of that data sharing and needs to be sure that everything is running according to the right administrative procedures. Then everybody will be peace of mind when using that technology. Stakeholders onboarding is also very important. it's pretty clear that each time we will initiate a project and deploy the technology in the lab, that will be something new for the operators. So the operators need to be trained on using the platform, but we need also to explain them the value and the importance of exchanging those data, the impact it has into the public health environment, so that they stick to the procedure, they welcome the use of that technology, and they stick to the procedures along the time. It's important not only at the level of the operators, but also at the level of the managers, because if the managers, if the supervisors are convinced on the value and the impact of that technology, then they will take care that the staff into the labs is consistently using the technology and be sure that all data are being properly harvested and provide comprehensive documentation over the health protocols. And finally, it's important to realize that project sustainability is very important. In different situations, we all know about projects that have been running for a couple of years and then fade away because of an inadequate considerations on sustainability. Sustainability is obviously a question of budgets. Budgets needs to be available along the years, so to continue supporting the tools, but it's also a question of training the people, including the training of technical staff, so that they become autonomous in the operations and maintenance of that technology and be sure that the project can continue in the long run. This is something, as Francis mentioned in the introduction, that we take care of within the SAVICS Academy initiative that will be mentioned in the conclusion of the seminar. That's what I was willing to share with you as an introduction and brief mention about DataToCare. I will now give the floor to Professor Dissou Afolabi, who will report about his personal experience of using DataToCare since 2016. And at the end of the seminar, I will come back for a few concluding remarks regarding DataToCare at SAVICS. Thank you.
Thank you very much, Dr. Jami, and a very comprehensive overview there on both SAVICS, but also DataToCare. And so let's hand it over now to Professor Afolabi to take us through the experience they've had with using this tool in handling the TB diagnostic network in Benin. Professor, over to you.
Thank you very much. So hello, everyone. I would like to share some slides with you to tell you about our experience in using DataToCare since 2016. Slide, please. Just briefly, for those who don't know Benin, Benin Republic is a, yes, let's say middle-sized or small country in West Africa between Togo and Nigeria. Is yes, about 30 million people and over 100,000 square kilometers. We detect, yes, every year a little bit more than 4,000 TB cases, and among them we have 15% of HIV among TB patients. Slide, please. Yes. At the national level, we have a national TB reference lab, and at the regional level, we have 11 intermediate lab managing, let's say, more or less 100 peripheral lab. Yes, we have 33 lab with gene experts. These gene experts, apart from the national reference lab in the region and in peripheral lab, the gene expert is the only molecular test we have. But at the national reference lab, slide please. Yes, yes. We at the national reference lab, we are the supranational reference lab designated by WHO since 2017, and ISO, yes, slide please, and ISO 15189 accredited since 2021. Slide please. Yes, we manage the network, and we have several tools to manage the network. As you can see, we have manual for the lab. We procure everything for the peripheral lab and as well as regional lab. We manage data, we do research, quality assurance, but also since 2016, we offer for our network connectivity. Slide, please. Yes, so I will now go in detail on this connectivity. Slide, please. Yes, a bit of history to tell you that we start this journey in 2016. It is in the framework of a research project funded by the European Union. And yes, we had within this research some discussion with Xavier Morel, which is the director of now DataToCare, but at that time, the idea, the discussion was about a platform named Gene Exchange, and it was a basic solution, connectivity solution, and that was previously developed. And from that, we started to work together to improve what has been done, and later it became DataToCare. At the beginning, we focused only on sending GeneXpert results to clinicians and informing patients about the availability of their results. If the test is performed, the SMS is sent to the patient so that the patient knows that his result is available. At the beginning, we focus only on these two aspects. Slide, please. And later on, the system has been upgraded. And apart from sending results to clinicians and informing patients about the availability of their results, we started to monitor the stats of treatment of patients with rifampicin resistance. Later, slide, please. Now, where we are, we continue to use this platform to do what I've mentioned before. But now, again, we continue to do that, and we add to that surveillance of and access of that data, and particularly remote monitoring of GeneXpert machine, including inventory management. We imagine the system, we discuss with DataToCare, and then they provided in the system, they provided this monitoring of GeneXpert machine, remote monitoring of GeneXpert machine. I will now go through this, what is this about? Slide, please. Yes, we told them to put in the system 4 indicators. The first one is the error rate. If the error rate from one lab using GeneXpert is above 5%, and then we think that there is a problem. This is the first indicator. The second indicator is if the lab is not using the system for 3 consecutive days, we consider this is a problem. And if we have in a defined lab a stock of cartridge for less than 2 months of consumption, we consider that also is a problem. And last, it is if there is an RR patient detected. This is not a quality indicator for the lab, but as you will see later, it helps us to make sure that this patient has been put on the treatment. And then these calculations is done for the last month. The data had gathered for the last month, and then if gathering this data and the indicator is calculated, and if its indicator is above the threshold, we will see what we call the color codes. If there is no indicator out of the range, then the lab will be green. And if the indicator, there is at least one indicator out of the range, the lab become red, and it is yellow when there was an indicator out of range, but the problem has already been fixed. But the time is not come now for the calculations for the indicator to become normal. So it will be yellow and it is blue. It means that the indicator was out of range and the problem is it's been fixed. So as you see, for each lab, I will show you later, for each lab, we will have a color: green, red, yellow, or blue, depending on the status of this lab. Slide, please. And that's where you can see, it is a bit small, but as you can see, we have the region, and in each region, we have the GeneSpect machine there, the lab with GeneSpect machine. And for each lab, you can see, aside to the lab, if it is, you have this button, it is red, it's green, it is yellow, or it can be also blue. So that, slide, please. So that, as you can see, in our maintenance unit, we have a big screen, and this is the head of this maintenance unit within the National Reference Lab. They have a big screen, and at least once per day, they have to watch this screen, and they will see the lab who are red, yellow, green, and not. And slide, please. Yes, this is the process when an indicator is out of range. Then they have to check if an indicator is out of range. It can be one or more of these 4 indicators. So they have to go within this lab. They will go to the software and to see which indicator is out of range. And after that, they have to call the lab, to discuss with the lab, and to fix the problem remotely. If the problem can be fixed, it can be, for instance, if the error rate is out of range, and they can see if they have a particular problem with one GeneSpect machine, and this machine can be excluded. They can work online with the lab so that this particular module can be excluded. So if the problem can be fixed remotely, it is done. If not, we plan an intervention so that they go on site to fix the problem. And all the interventions in each lab is documented. And so that when you go to each lab, you can see if what had been done before for this particular lab. Slide, please. Yes, yes. Apart from remote monitoring of these indicators, yes, we can access the data from each lab. We can have individual data for each lab. You can have some data that has been gathered, as you can see there: positive patients, negative, the detection of TB per load. You have several informations which can be used to better understand the network and for surveillance purpose. Slide, please. Yes, what are the key elements of the system in Benin? Yes, the first one is the server. We have a server, but the server is installed within the compound where the NTRL is, and is closely monitored by an IT person, which is, yes, every day available. And also for each site, we have a modem with USB, and then this is installed in each of the lab. Slide, please. Apart from this system, the internet connectivity, we use a local company and then we use prepaid internet, and this is sent remotely, is sent to each of this phone number for each lab, so that from the central level, we are able to send what we have to pay to have the internet accessibility for each of these lab. We can send it remotely, and one person is dedicated to follow if there is internet everywhere in each of these lab. About data ownership, yes, it's fully, this data ownership is fully managed, and the security is fully managed by the NTRL. And yes, if external interventions is needed, like that SAVICS has to work on this on the system, we can grant them with a temporary access, and after that, this is closed. So there is a national ownership of the data. Slide, please. About personnel, this is key. This is really key because, yes, at the beginning, for the development of the solution, yes, as the lab manager, I was really involved in working with service to be able to have to customize the system so that finally we are happy. And the IT person is also available all the time, and that he is in touch with SAVICS and me, so that we are able to put the system in place. At the operational level phase now, it's we need 3 key persons. We have 3 key persons at the NTRL: the IT person, a lab technician who is in charge of ensuring that internet is available everywhere in each of the lab, and also the personnel from the maintenance unit. This person, as I showed you before, is in charge of looking which are the lab in red, and then working with this lab to fix the problem they have. And if needed, as I said, they are able to go on site and to fix the problem. These are very key persons we have at national level to maintain the system. At operational level, yes, the personnel is also trained, and they are able to manage the solution at each site. About budget, this has changed over the time, and yes, but currently for the amount of software, or the amount of GeneXpert we have, yes, the budget is for 1 year is a little bit more than $50,000 US, and this is planned to be funded in global funds for our system. And yes, for this budget, this amount, it included several things, not maintaining the system, and we need some updates, some new lab to update. These all are included in this contract. And if there is a problem, anytime SAVICS is available to help us. I can show you the results at the national level we have during 2022 and 2023. And as you can see, the results are quite good. In 2023, we faced some problem of failure of module, but since we have some delay in renewing the contract with CFED, where this module has not been changed on the time, so that we face some issue. But as you can see, globally, we have, yes, the system is well managed. yes, it's not only because of DataToCare, but DataToCare participated to this result very well. The slide, please. Yes, what are the factors for success in our environment? Because in our region, we can see that there are many laboratories, many countries where the system has been deployed, but in few times it stopped. What are the key factors for success and in maintaining the system so far in our country? I think the first one is the personnel. At the national level, we are very committed. We try to have a strong organizations. We have to make a lot of effort to keep the system, since as we will mention for challenges, we will see the challenges later. We have several challenges, so that to overcome these challenges, we have to be well organized and to put a lot of effort so that we are able to keep the system in place. The second factor is the server. The server is available in the same compound with the National Reference Laboratory. We are there, we monitor it with the IT person, and if there is a problem, we together we will fix the problem very quickly. The electricity is still an issue in our countries, as you know, but we have an UPS for the server and the backup generators. We also have a close relationship with the supplier, so that when we have a problem, we can call them, we can send them an email or a WhatsApp message, and they respond promptly. About the target, yes, as you can see, and I can come, and Bertrand will say as well, that we have several features for the DataToCare. But we, at our level in Benin, we really focus on quality indicators. We put all our effort in that, a little bit in data access and surveillance, but mainly on quality indicators, which means that, yes, putting effort on that, we try to make sure that this is working. And yes, the key factor is also, yes, the number of machines is relatively limited. We just have 33 machines. Yes, we are increasing it, but it's not 500 machines like in some countries like Nigeria. So here, since it's a small number, it is also manageable. It's manageable because of this relatively limited number of lab we have. We are buying more and more machine, but yet we have only 33 machines available in the countries. For the supplier also, yes, since SAVICS, they respond very quickly to our demand. This is very helpful for us. Slide, please. Yes, but we have several challenges. You know that, yes, the first one is the budget. And there's not only the budget can be available, but sometimes we are facing, yes, hard procedures with global fund, so that the money is there, the need is there, but to get the money and things done, it's not easy at well. This is the first challenge. The second one is the internet. The system offered by the local cell phone provider that does not suit, this system does not really suit for what we want. What we want is just small amounts of megaoctets, so that they are able to send the data. But this is not always, this does not suit really with what we want. Electricity, yes, I told you that we have UPS, we have backup generator, and yes, but still it can be an issue, though it's rare in our environment. And about personnel, yes, we try to have at the central level people well dedicated, and not only one person, another person as backup, but at operational level, it can be due to the mobility of the personnel, it can be an issue sometimes. Some people are removed from the lab, and sometimes we are not aware on that. And if it's when we find the problem that we realize that the person has changed, but we have a system in place in our country so that if we have a lab manager new in a TB lab, this person is sent to the central reference lab so that he is trained. Next slide, please. About the perspective, yes, our colleague from the HIV program are working to have also the system so that the system will be extended to the HIV program. Yes, instead of having the contract every year, we are, yes, thinking it's not already there. It's not yet there. How to have a long-term contract, 3 years contract. If you have a 3 years contract, then we are more comfortable to manage the system, and also to explore over possibility from the system, over features and the link to DHS2. We are thinking or working on those aspects. And to conclude, slide, please. Yes, to conclude, I would like to say that connectivity solution has been useful for us to improve quality in our GeneXpert lab. There, as you know, there are several systems in place. The one we use in Benin is DataToCare. Its implementation has been successful thanks to the strong commitment of the National Reference Lab and the lot of effort we put of keeping the system, though you know that we have several constraints. We have several constraints when you manage such system at national level in low research countries. Slide, please. I will say to finish that it was hard, but it was feasible. Thank you very much. Slides. Thank you.
Thank you. Thank you very much, Professor Afolabi. An exciting and super experience there from Benin, really highlighting the real-time visibility of functionality at our GeneXpert sites using this application, but also remote access to data from all over the country, again, using the system. And of course, there is huge issues around the success, the factors that influence success in implementation. And again, very, very much appreciated from you and the team in Benin doing a great work in applying this application. We have questions coming, and Damien, I know you have that little bit on the academy. I'll give you some time later, but let's deal with some of the few questions that are coming so that we do not lose them out. And I will start with you, Damien. You've taken some time resting, and there is a question on where do you apply this system? Would you encourage that this system is applied at the individual lab level or at the national level or regional level where you're dealing with a network of laboratories? And aligned to that same question, is it only applicable when you're dealing with automated analyzers that have, let's say, computer-driven softwares, not manual platforms?
Okay, two parts of your question. So first, about where to use DataToCare. As it was emphasized, the key value or the key functionality from DataToCare is about collecting data from a network of labs and concentrating these data just to facilitate the surveillance or operational management, as Professor Dissou has emphasized, monitoring the need for distributing the cartridges or the reagents across the network of lab. So probably the value of DataToCare is not dominant in a single lab, but it proves useful at the level of a group of labs. Then it depends on the way the health systems are organized within the country. If there is a country-level organization, then it's recommended to cover as much as we can the labs across that country. If there is a state-based or a province-based healthcare organization within the country, then we can certainly consider a deployment over one province, one state, a second state, and progressively cover the different states, bring the value at the level of this decision power, I would say, within the country structure. And if it proves useful within the country organization, to concentrate the information from different states over the whole country. Also, what I would need to emphasize is the progressive importance also to bring transversal value out of these technologies within healthcare. As it was emphasized by Professor Dissou, we initiated the use of DataToCare in Benin with the TB program. And now the objective is to expand into the HIV program and possibly progressively touch other healthcare programs. There is no specific dedication of DataToCare to one program, but the value is when there is a possibility to merge the data from a variety of situations and extract added value from combining this information. So there is no restriction at all. We meet the specifications or the expectations of the stakeholders who are willing to adopt the platform. To your second point about do we need to work with digital devices or is there a possibility to manual processes? I would say both. If the devices are open, are digital, have a digital nature, like GeneXpert, for example, they have a possibility to access the data on a digital channel and retrieve the data to make the data available to a system like DataToCare. Of course, we will work with that type of data harvesting procedure. If there is no such technique, because we talk about a manual technology or something else, then we will adapt the forms and make it available through what we call DataToCare desktop, which is the end user interface, so that the people can record the data manually if there is no direct digital access to the machine. So the value is to be as holistic as we can and facilitate the access to all laboratory data, either digital if the data is on a digital format, or by adapting the forms if needed.
Thank you. I mean, I'll keep it with you. And just a follow-up question on especially expanding the scope to include other disease programs. What does it take to do that? Is it just the same system and you're just introducing additional equipment on the system, or there are other considerations that countries should be taking before they can bring in other disease programs?
In the vast majority of cases, we expand on the basis of what's already being installed. So typically, let's take the example of a country using it for TB and willing to get into HIV program usage. Then we will just upgrade the platform by providing additional forms and additional dashboards that meet the specificities of HIV diagnosis in terms of what are the indicators that are worth being computed, that are worth being supervised, what type of data should be recorded, should be depicted on screen. If we need to interface additional instruments, we will do that, but we will capitalize on existing platforms. This is a modular system, so we can always add new functionalities, new interface, new modules on the basis of what is already being used.
Great. And one last one with you before I move to Professor Afolabi. It's on the compatibility with some of the platforms out there. And a colleague from Kenya is asking that sometimes when you change the configuration to try and accommodate these additional softwares, you end up compromising the inbuilt connectivity within the machine. And he was actually making specific reference to GeneXpert machines. And so kindly confirm, we do not know whether this reconfiguration was being done by the lab team or the software developers, because that is also one key area that then can lead to correct and effective interfacing or actually messing it up. So are there some platforms that are not compatible, or are there some considerations that should be taken care of when interfacing this application with the existing diagnostic platforms?
Thank you. That's indeed a very important and very interesting question. I saw that on the chat as well. There is no risk of discontinuing or corrupting some systems that are up and running, because DataToCare is just an external system that harvests the data without touching the systems that are at the origin of the data. So there is no need, no risk of corrupting a situation in which a few technologies that are up and running do behave consistently at the time we roll out. Now the question is important, because indeed these technologies like the GeneXpert system evolve over time, and it may happen that when we roll out a DataToCare configuration, it's running well with the GeneXpert version that is being in place at the time we install the system, but after 2 years, Cepheid company may upgrade GeneXpert to a new version which is not necessarily compatible with DataToCare system, which was installed back 2 years ago. And that's all the value of having the so-called long-term relationship that Professor Afolabi was mentioning in his presentation. If we have a support and maintenance relationship which is maintained between us, the software provider, and the users into the field, then these users can come back to us, say, hey guys, we have received a new version of GeneXpert. They have changed the pilot of their device. Can you upgrade DataToCare so that we keep on using with the new version of GeneXpert? And we'll say, of course, yes, we will do it. We will do it, and we upgrade the system. We need to have this support and maintenance contract in place. But when we have this kind of relationship with the countries, it's very smooth. We organize that smoothly with the country. We do that offline and outside of operational hours of the lab, so that we are not interfering with the work into the lab, and we ensure that the system remains up and running consistently. I hope I'm answering the question.
Thank you. Yeah, perfectly well. Let me get to Professor Afolabi with a few questions, and then I'll get back to you, Jamian. So, Professor, you indicated that one of the challenges is actually power outages, electricity outages, and internet outages. And so there is a question relating to do you get the backlog of data that may have been accumulated during the outages, whether internet or power outages? Do they get uploaded on the system automatically once you get reconnected, or do those get manually kind of uploaded into the system based on your experience in Benin?
Yes, thank you. Yes, yes, there are several aspects of the system, of the questions. The first one of this question is yes, at the beginning, what was there was that if they have GeneXpert machine, they have the lab technicians, they have first to put the data in the GeneXpert machine and later to the DataToCare. So they had before to write the same information twice. And people in the lab at that time, they avoid using DataToCare, they go directly to GeneXpert. But later on, the system has been improved so that the information is sent only per DataToCare. Yeah, so that's the first one. This help the lab to manage the data well. But when they send, they write the information and the internet is not there, the data, all the information are there. And as soon as internet is back, this information will be uploaded to the system, and so that we can have. And yes, and for the server, the problem we can have is the problem of failure of the server. That's why for the server, every day we have a backup for the server, and we have this backup. and so that even if there are some problem, we are able to capture to have mainly that main data. So from our experience, yes, when the internet, we have internet failure and the internet is back, we are able to, the data are able to be uploaded to the system. Thank you.
Thank you. Thank you very much. Let me give you some 3 to 5 minutes to quickly run through the SAVICS Academy, and then we'll see if we can make some time for additional questions. Kindly, please, very briefly on the SAVICS Academy.
Very briefly. Thank you very much. So on that respect, let me first highlight again the map of the countries in which DataToCare is being installed. It's reflecting that we build up on the I would say the recommendations and the ideas that have been formulated not only by Professor Dissou and his team, but progressively coming also from the other countries, because all of these countries have come up with ideas with specifications that are based on the progressive evolution of the platform. Now, talking about SAVICS Academy, I will skip this one on behalf of time. So, Professor Dissou has emphasized the problem of staff attrition, which is a real problem. We know that in most of the African countries in which we work. And that's really the reason why we've put in place SAVICS Academy. SAVICS Academy is an educational program which is mapped onto the support and maintenance activity that are proposed by SAVICS. By default, I would say SAVICS propose to ensure the support and the maintenance of DataToCare along the years. But there is a possibility, while we are ensuring the support and maintenance, to bring local staff from the labs, from the program, from the health program, being incorporated into SAVICS team and receiving a training on how to support this kind of technology, how to help the users into the field, how to troubleshoot the software if there is a problem. And by going into this educational program, the local people become knowledgeable for ensuring locally and autonomously the support and the maintenance of DataToCare. And that's the possibility, first, to ensure that after a few years, the cost is reduced, because if the local staff is able to perform the support and maintenance, then there is no need or less need to access to the support and maintenance by the software provider. And if the country is willing to put every year a few of these IT specialists recruited and enrolled into the training program, then we compensate the staff attrition. It's clear that the people who will be trained, some of them will depart to different jobs after some time. We know that that's a reality in all the countries. But if the people interested by this educational program are constantly, years after years, bringing people into the educational program, then the flow of people is compensated by the flow of people that are being trained, and overall the country becomes autonomous for mastering this kind of technology. We remain available in the background when new features have to be developed. We remain available in case of big problems, but the vast majority of the support needs become locally supported. That's the idea, that's the concept of SAVICS Academy. That was really a need expressed from the countries and from the donors, from the Global Fund and the other organizations that are supporting this kind of projects, saying, okay, we agree to put money on the table, but we want that this technology remains usable after a few years. And that's the rationale for proposing SAVICS Academy. I will not get further into this, but I will be happy to take questions. And I would say that if other people are willing to receive specific documentation or ask questions after the seminar, this last slide is showing my email address. Everybody can feel free to communicate directly to us, and we will take the question and answer the questions with pleasure. Thank you very much.
Thank you. Thank you very much, Jamian. And definitely the slides here will be shared with the team, and that mail address will be part of that. And colleagues can get back to you as and when they need. And also thank you, Xavier, for dealing with most of the questions in the chat. Those that were still pending, we're glad that you've dealt with them in the chat. And so, colleagues, we know that even the very best will always come to an end. And given that really time does not wait for us forever. And so we've reached to the top of the hour, and we would like to then thank you very much for being part of this. And so I'll just give my presenters 1 minute each to deal with just their closing remarks. And so I'll start with Professor Afolabi, your closing remarks for today's session.
Yes, thank you very much for offering me the opportunity to share with people. Yes, about this system we are using in our in Benin. Yes, beyond DataToCare, there is a patience. So what we have to think is how to improve the quality to these patients. And DataToCare and also other connectivity solutions help for that. Yes, there was a question about sustainability. Yes, we have a problem about sustainability for drugs, for the reagents, but also for connectivity. We need money for all those things. But if we think that is important, we have to advocate so that we have the money to do what we think is important for the patient. Thank you very much.
Thank you, and I'm giving you 30 minutes, Damian, to do your closing remarks.
Thank you very much. Well, I think the format of this webinar was really perfect because a technology like DataToCare means nothing if not answering the need of users in the field. So in that perspective, having not only a brief overlook over the technology, but most importantly, hearing Professor Disu emphasizing how it's impacting him and his team on a daily basis is really the perfect scenario for such a presentation, and it highlights that when people are working together for a common goal, it's really providing meaningful results. And that common goal was perfectly summarized now by Professor Disu in his concluding remark. We do that for one single reason. We know that there are patients down the road waiting for us, and what we want to do with our own skills and our expertise is to provide meaningful solutions to have better outcomes for the patients. That's what is motivating every single of us at SAVICS, and we are happy to do that with the help and with the collaboration with organizations and people like Professor Disu and co-workers. Thanks a lot for your attention this afternoon.
Yeah, thank you very much, colleagues. And we've come to the end of this session. The slides will be shared with us. The link to accessing all resources recorded and slides are also available on the chat. Please look out for that. But also we'll be using our other social media platforms to share the slides and recordings that are available for your ongoing reference. Again, thank you very much to the team from SAVICS and also Professor Afolabi and his team from Benin, sharing very exciting experiences and applications. Until we meet, from us, ASLM, do have the best of your morning, afternoon, or evening, depending on where you're joining us from. Thank you.
Thanks.